Hello, this is Dr. Grant Cooper at Princeton Spine Joint Center. In the next 10 minutes, I'm going to tell you everything you need to know about sciatica so that you understand what it is and what it isn't, that you know if you have it or if you don't, and how you can go about getting better as quickly and safely as possible. That's a lot for 10 minutes, but we're going to get it done, so let's jump in. First, when we use the word sciatica, we generally are referring to pain in the leg that comes from the back. To be precise though, true sciatica is an impingement of the sciatic nerve, which is the largest nerve in your body and runs from your buttock down the back of your thigh and your leg. True sciatica is relatively rare, and it generally happens when the piriformis muscle, which is in the buttock, spasms and irritates the sciatic nerve as it passes by or through it. True sciatica is more common in younger people and in particular with young runners. For more information on true sciatica, including treatments, you can check out our video on piriformis syndrome. Now, for the vast majority of cases, most people, patients and doctors alike, will be using the word sciatica to simply refer to nerve pain in the leg that's coming from the back. It's clumsy medical vernacular, but it serves its purpose. If we were being more faithful to medical terminology, being more accurate, we'd refer to generic sciatica with the more accurate terms like lumbar or lumbosacral radiculopathy or foraminal stenosis. So you can see why we sometimes just say sciatica. Anyway, sciatica happens when the hole in the spine where the nerve exits, what we would call the foramen, becomes smaller or stenotic. That's why you'll sometimes hear that term foraminal stenosis. As that hole where the nerve exits becomes smaller, it doesn't necessarily compress the nerve, though in severe cases it can. But more commonly what happens is that the hole just becomes smaller, right? It's not this, it's just a smaller hole. And that sets the stage for the nerve to become irritated as it then passes through this tighter hole. In the spine, anything that narrows the hole will contribute to the stenosis or the narrowing. So for example, the intervertebral disc can herniate and narrow the hole. The facet joints in the back of the spine can hypertrophy or overgrow, and this can narrow the hole. Basically, just as you've seen in older folks when their fingers become arthritic and overgrown, so can these joints in the back of the spine called facet joints. As they overgrow, they'll encroach on the hole where the nerve is coming out. If the disc herniates back, that can encroach on the nerve. There's a large ligament in the back of the spine called the ligamentum flavum. That can hypertrophy or get bigger, or it can buckle inward, and that also can contribute to this overall narrowing of the hole where the nerve comes out. Now, in a younger person, you may have an isolated disc herniation that causes sciatica. This usually presents more acutely and more dramatically. But more commonly, as people age, there's a confluence of a few different factors that all lead, in the end, to a narrowing of the hole. Now, as we said, it's not a true compression of the nerve, but rather what happens is the hole gets smaller and then the nerve gets irritated, and if there's an inflammatory reaction, that inflammation can then cause the symptoms of sciatica. If there's no inflammation, there will not be any symptoms. That's why people can have a terrible looking MRI, but still feel great if there's no inflammation. And it's why someone can have a relatively good looking MRI with relatively little stenosis, but still end up in terrible pain if they're having lots of inflammation, if they just are unlucky enough to have a big inflammatory response to that. Again, it comes down to if the body responds to the degenerative changes with inflammation or not. Now, if the stenosis is chiefly caused by a herniated disc, herniating backwards, the symptoms are usually worse with sitting or bending forward, because this position puts more pressure on the disc, which then puts more pressure on the hole where the nerve is exiting. On the other hand, if the stenosis is being caused more by the facet joints in the back of the spine or the ligamentum flavum, then the symptoms will be worse when you're standing and walking, and usually will feel better when you're sitting. And we think of this as more classic spinal stenosis types of symptoms. And it just depends on where the problem that's causing the symptomatic stenosis is coming from. Now, people with sciatica will typically describe the pain as sharp or shooting, electric, burning in nature, Occasionally, the pain might feel dull or aching, more like a toothache. As the nerve becomes more and more involved, people may feel more numbness or tingling. And if the nerve is very badly affected, then the person can begin to develop weakness, like a foot drop or other weakness in the leg, depending on which nerve in the spine is actually involved. Generally, if the lower two nerves are involved, these would be the L5 and the S1, towards the bottom of the spine, these happen to be the two most common nerves to be inflamed, then the symptoms that one will tend to trace the actual sciatic nerve down the butt and into the back of the thigh and leg. This is because the L5 and the S1 nerve roots join together to form the bulk of the sciatic nerve. Whereas if the L4 nerve root were involved, then the symptoms tend to go down more into the front of the leg and the inside of the lower leg. The L3 tends to go more into the inner thigh, and the L1 and the L2 more into the groin. Depends on which nerve root's involved. Now, importantly, if you are experiencing worsening weakness or worsening numbness, or if you were to develop any changes in your ability to control your bowel or bladder, then these are what we would call red flag signs, and they may indicate a serious nerve injury. So if that's the case, you should be seen immediately by your doctor, and you may need urgent surgery. We should stress that this is unusual to occur, but at the same time, it can happen. And it's very important to keep in mind and attend to it emergently if it does happen, because otherwise there can be very serious consequences such as permanent nerve damage, incontinence, and paralysis. So while it is unusual, it is something to take very seriously. For the vast majority of cases, the symptoms of sciatica develop much more slowly and involve mostly pain. Again, the symptom results from the inflammation around the nerve. Inflammation is a protein response, but the best way to think of it is that it's like a fire. And as with any fire, there are two basic ways of putting it out. One is to move away the fodder to let the fire die down. In a surgeon's world, moving away the fodder means to go in and surgically decompress the nerve via either a discectomy or a foraminotomy. Basically, in this sort of surgical approach, the surgeon goes in and takes away as much of the stenosis as needed to take the pressure off of the affected nerve or nerves and basically let them breathe more. For some people, depending on the severity and chronicity of symptoms, and also depending on what non-surgical treatments have been tried, this really might be the best approach. But for most people, there are very effective non-surgical treatments. The other very important and much more common way to move away the fodder from the fire is with targeted exercise. Specifically, this means to stretch and strengthen the muscles around the spine in order to unload the spine and take the pressure off of the affected nerve or nerves. Now, for more on the specific exercises, you can check out our video on the best and most effective exercises for spinal stenosis if your pain is worse with standing. And you should check out the video on the best and most effective exercises for disc herniations if your pain is worse with sitting. Some of the exercises in the two videos are going to be the same, but some of the exercises are going to be subspecialized depending on when you have the worst pain. Now, sometimes you do all the exercises and it's just not enough to unload the spine, or the symptoms that you're having are so bad that you can't even do the exercises because of the pain. The other way that you can go about putting out the fire is with a fire hose. The fire hose here is anti-inflammatory medication. Anti-inflammatory medication can mean oral medications or it can mean supplements. For example, supplements might include bromelain or curcumin or tart cherries. There's lots of supplements that one could use. Medications might be over-the-counter non-steroidal anti-inflammatory medications like Advil or Aleve, or prescription-strength non-steroidal anti-inflammatories. The limitation of taking oral medications or supplements is that only about 2% of what you take by mouth is going to reach your spine where the inflammation is that you're trying to target. So by far the most effective way to get anti-inflammatory medication to the right spot is to use X-ray guidance to perform an epidural steroid injection. In this way, you can deliver the anti-inflammatory medication directly to the site of inflammation. When this is effective, but of course it's not always effective, but when it's effective, it can take away the inflammation and therefore the pain. When epidural steroid injections work, it usually takes a few days or a week for them to actually start to work, as the steroids are metabolized and this effect crescendos in terms of its effectiveness over the course of a couple of weeks. As the symptoms are improved from an epidural steroid injection, it's important to realize that this isn't because the pain is being masked. It's not like you just numb the pain. The pain feels better when it feels better because the inflammation that was causing the pain is actually greatly reduced. However, an injection or oral medication for that matter cannot affect the biomechanics that led to the inflammation in the first place. So for this reason, when injections or medications are used to reduce the inflammation, they should always be thought of as windows of opportunities during which you can work on the right exercises to help change and improve the underlying biomechanics so that as the medication wears off, and it generally does wear off in about 3 months, the symptoms ideally do not return. That's your 10-minute sciatica tutorial. I think we finished in time. I hope you found it useful, and if you have enjoyed it, and if you've learned something, then please remember to like this video, subscribe to the channel, and tell a friend who might also enjoy it, because that's the way that we can spread good health information and achieve good health together. As always, if you have questions that you'd like me to answer in a future video, or if you have any comments you'd like to share, you can reach me at drcooper@princetonsjc.com, or of course you can leave a comment in the comment section. Thank you very much.